Hi, I'm Maddie the Doula Lady, and welcome back to Birth World Weekly. This week gave us a lot to hold. We had a full week dedicated to Black maternal mental health. We passed a milestone in doula Medicaid coverage that I have been watching for a long time. And the United Nations issued a warning about what is happening to maternal health funding globally that I think every birth worker needs to hear. I also want to talk about what is happening right here in Louisiana, because the numbers are telling a story we cannot afford to ignore. Let's get into it. The world is cutting the money that keeps mothers alive. UNICEF and the World Health Organization issued a formal warning this week that the progress we have made on maternal mortality is now in serious jeopardy. Global aid dropped by 23% in 2025. It is projected to drop another 5.8% in 2026. And nearly two-thirds of all maternal deaths in the world happen in countries already marked by conflict or instability, exactly the places that cannot absorb these cuts. Here's the number I want you to sit with. In 2023, 260,000 women died from complications of pregnancy or childbirth. We have made real progress since 2000, a 40% global decline in maternal deaths. But that progress slowed significantly after 2016. And now we are watching the funding that sustains it get pulled out from under the most vulnerable communities in the world. This is not abstract. When aid gets cut, midwives lose jobs, clinics close. Women who would have survived do not. We have to keep talking about this. Midwifery saves lives. The data is not subtle. A new analysis published this week found that if the world achieved universal coverage of midwife-delivered care by 2035, we could prevent 41% of maternal deaths, 39% of neonatal deaths, and 26% of stillbirths. One profession, those numbers. The world is still short 1 million midwives, but the evidence for this work has never been stronger. Black Maternal Mental Health Week just wrapped. Here is why it matters. July 19 through 25 was Black Maternal Mental Health Week, and this year the conversation was urgent. Nearly 40% of Black mothers experience a maternal mental health condition during or after pregnancy. That is almost twice the rate of all women. And the maternal mortality rate for Black women in this country remains at 50.3 deaths per 100,000 live births, more than 3 times the rate for white women. This week, the Shades of Blue Project and March of Dimes led a week of storytelling events, a national leadership retreat, the Black Maternal Mental Health Summit, and the launch of a new National Rest, Repair, and Resistance Day. The message was the same one those of us in this community have been saying for years. Screening, support, and access to affirming mental health care are not optional. They are how we keep Black mothers alive. Saving Black mothers starts outside the hospital. Experts agree. Word in Black convened a powerful panel this week on exactly that theme. And the conclusion was not surprising to anyone in this work. The gap in pregnancy-related deaths for Black women does not come from biology. It comes from systemic inequity in access, opportunity, and care. The panelists, representing March of Dimes, the Shades of Blue Project, and Johns Hopkins Bloomberg School of Public Health, named community-based care, midwifery, doula support, and economic investment as the interventions that actually move the needle. They talked about reclaiming the collective communal care that has always been part of Black birthing culture. Midwifery as a way of mothering the mother. Community as the intervention. We know this. We live this. It is good to see the research catching up. More than half of states now cover doulas through Medicaid. I have been waiting to say that sentence for a long time. As of this year, 26 states, plus Washington, D.C., provide Medicaid coverage for doula services. 2 years ago, that number was 12. 7 more states are actively implementing their programs right now. We are watching doula care shift from something wealthy families could purchase to a recognized, reimbursed part of the maternal health system. And that shift is because of advocacy, because of birth workers who showed up, testified, organized, and refused to let this work stay invisible. Here in Louisiana, Medicaid doula coverage went live on January 1st of this year, meaning right now, Medicaid clients in our state are entitled to doula support before, during, and after birth. Implementation is still rolling out, and there is work to do to make sure families actually know this is available to them. But this is a landmark moment, and it belongs to every person who fought for it. The good news and the hard news together. Louisiana's Medicaid doula coverage going live this year is real progress. And this is also true. A 2026 report from Tulane University's Newcomb Institute found that 29.6% of Louisiana parishes are maternity care deserts. Nearly 1 in 3 parishes. People are giving birth in communities with no OBs, no midwives, no maternity hospitals nearby. Advocates from the Louisiana Coalition for Reproductive Freedom and Birthmark Doula Collective held a virtual press conference in May to discuss what this means for families across the state. Medicaid coverage for doulas is a powerful tool, but it only works if there are enough trained doulas and if families know it is available. Those gaps are where the work is right now. If you are a doula in Louisiana and you have not enrolled in the Medicaid program yet, now is the time. And if you know a family who could benefit from free or reduced cost doula support, Mary's Hands Network is currently accepting clients due September 2026 and beyond, with full and partial scholarships available. Visit maryshandsnetwork.org. 2 new studies making the case for doulas. In the same week, a new systematic review published this month in PubMed looked specifically at doula support and breastfeeding outcomes. The findings are consistent with what we see in practice. Doula-supported births show improved breastfeeding initiation rates, fewer interventions during labor, lower rates of postpartum depression, and higher overall birth satisfaction. We have known this. Now we have more peer-reviewed literature to say it with. And a new scoping review in NPJ Women's Health Through Nature looked at doula support not just at birth, but across the full pregnancy continuum: prenatal, labor, immediate postpartum, the weeks and months after. The review confirmed that the benefits of doula care are not limited to the birth room. They extend all the way through. As more states move toward Medicaid reimbursement, this kind of evidence is exactly what advocates need at the policy table. Bring this one to your next meeting. Today, July 26th, is the 36th anniversary of the Americans with Disabilities Act, signed into law in 1990. I want to sit here for a moment because this anniversary belongs in a Birth World Weekly. Disabled, pregnant, and birthing people are among the most underserved populations in maternal care. The ADA is foundational to their right to accessible birth settings, to informed consent, to protection against forced interventions. And yet disability and pregnancy still intersect in ways our healthcare system consistently fails to address. As birth workers, honoring this anniversary means asking ourselves honestly, how are we showing up for disabled clients? Are our birth spaces actually accessible? Are we trained to advocate for their rights in the rooms where decisions get made? The work of equity in birth includes this community. Full stop. I'm Maddie, the doula lady. Keep supporting families, keep showing up, and I will see you next Friday.